So the basic idea is that when we work, for example, with droplets, which have like picoliter volumes rather than microtiter plates, we have two main advantages. So one would be we can have much higher throughput. So we can process millions of samples rather than, like, let's say, a few hundred or a few thousand for microtiter plates. But another very big advantage is that the starting material can be something that is not applicable to conventional high throughput screening. So for example, think of patients' biopsies, or in another application we just analyze single cells expressing different antibodies, and we just need a single cell, single clone to kind of do these tests. So for antibody discovery, for example, we can simply screen plasma cells from mice or even from human beings, and we have done this in the lab. So, you know, instead of producing hybridoma cells or other stuff it's very time consuming, we can screen much larger fractions of the immune repertoire compared to conventional technologies. And for personalized therapy approaches, the big advantage is we can directly work with patients' biopsies. For example, we can take tumor samples and then do drug screens directly on these cells rather than cell lines. So I think one big challenge for droplet microfluidics is robustness. So, you know, I was saying we can do many things better than microtiter plates, but there are also a couple of disadvantages, such as that droplets in theory can fuse, which you don't want. Another thing is people develop many different modules for droplet microfluidics, but they are maybe not perfectly compatible with one another. So I think the big challenge is to integrate different modules into one single platform and to increase robustness.